Hello and welcome back to Curry Soup. Today we're going to be talking about cancer. We'll be covering everything from what is cancer, how does it grow, how does it spread, what are the symptoms caused by cancer, and how do they actually treat cancer. If before this you never knew what cancer was or how it actually happens, today after this video, I guarantee you'll understand it slightly better than before. So without wasting any more time, let's get straight into it. We all started as a single cell, and that one cell eventually divided into 2, divided into 4, divided into 8, and that's how growth happens. That's what we call growth in a cellular level. To us, maybe growth is something simple like a person getting taller or wider. But when it comes to cells, it's a quite complicated process and there are a lot of steps the cells has to follow in order to divide itself. We have approximately 100 trillion cells in the body, and when there's so much cells in the body, every now and then things can go wrong. Every time a cell divides itself, it sends sort of a blueprint to its daughter cells. It's sort of like a very detailed instructions for the daughter cells on how it should build itself up. With 100 trillion cells in our body, every now and then things can go wrong. When I say something can go wrong, meaning that the blueprint that the cell sends down to its daughter cells is wrong, meaning the instruction that it gives is either incomplete or it's just faulty, it's just a mistake. So when this happens, an abnormal cell appears. This is what we call as a mutation. Usually when this happens, the cell will notice itself and shut itself down, or the organism will notice this mutated cell and work to eliminate it. But when the mutation is happening all over the place at a very high rate, it's almost impossible for the body to eliminate all of those. And this will ensure that this mutated cell bypass this fail-safe the body has made for itself. And this will cause these mutated cells to divide itself recklessly and very fast. One mutated cell is going to be dividing itself into 2, into 4, into 8, and at every stage of this division, it's passing down the faulty DNA to its daughter cells. The wrong instruction is being passed down. As a result, we have cancer. This division of mutated cells can go on for days, weeks, months, even years sometimes, until coincidentally one day you notice a lump in your breast, or you could have problems going to the bathroom, which could indicate problems with the intestine, prostate, or even the bladder. Or in rarer cases, you just go for your routine blood checkup, your normal checkup, and the doctor notices your blood work has high white blood cell or elevated liver enzymes. After this stage, the next course of action is to locate where the cancer is and how far it has spread. If the cancer is only at one place and it's slow growing, the doctor will usually recommend surgery to remove the tumor. If it's a very fast growing cancer and it has already invaded the nearby tissues, the doctor will usually recommend either radiation or surgery plus radiation. And if the cancer has already spread and it's basically everywhere in the body, for example leukemia, doctor will usually recommend a chemotherapy or chemotherapy plus radiation. So we've all heard of radiation and chemotherapy before, but what is it exactly? Well, radiation and chemotherapy both help cancer patients by targeting cell division, meaning they're destroying the DNA of the mutated cells, which means the blueprint which actually created the cells are no longer available, so the cancer cell can't multiply anymore. But the drawback of it is chemotherapy and radiation both does not only target cancer cells, they target all cells. For example, radiation will target all the cells where it's pointed at. It's like a torchlight. You point at one place, it's going to target all the cells in that place. And chemotherapy goes through the blood, so the entire blood system, wherever your blood goes, everywhere is going to be affected. For example, if we take a liver cell only divides itself or only multiplies when it's stressed. So a chemo drug will not have much effect on it. Compare that to your hair cell, which has very frequent division, grows all the time. And like I said earlier, chemo drugs and radiation therapy target cell division. So every time this hair cell divides itself, it opens itself up for more attack from the chemo drug. Cancer cells, they grow very frequently and grow very recklessly. So this drug is a very good method of killing these cancer cells, using the cancer cell's own advantage against itself, the ability to multiply very fast and very recklessly. The more frequently a cell divides itself, the more likely it is to be killed by this chemotherapy or radiation. Example of frequently dividing cells are, for example, hair, skin, gut, blood, and this explains all the symptoms or all the side effects which come from chemotherapy or radiation therapy. For example, hair loss, skin rash, nausea, vomiting, weight loss, and pain. I hope this video gave you some clarity about what cancer is, how it's created, how it multiplies itself, how it invades other cells, how it's treated, and also some of the symptoms or side effects which come along with the treatment. If you found this video valuable and you learned anything at all I ask you is to share this video with a friend or a family member. Spread the knowledge. And until another informative video, in anything you do your best and be the best version of yourself. Bye bye.